Thank you for joining us. This is our Women's Vascular Health and Risk Factors for Dementia webinar, presented by the Dementia Society of Ottawa and Renfrew County. My name is Kate Holmes. Before we get started, I will tell us a little bit, just make sure that everything is working on my screen, and advance my slides. There we go. I just want to tell you a little bit about today and some housekeeping messages. Here we go. So as Herman, who's helping us out on the technical side of things, just told us, this webinar is being live cast on Facebook and recorded for future on-demand viewing. Everyone but our speakers and the event coordinators are muted today. We encourage participants to pose questions in the chat function of either the Zoom web application or on Facebook. And we'll do our best to answer them at the end of the webinar in our Q&A session. Si vous avez des questions que vous voulez poser en français, faites-le. Et on vous répondra également en français et on pourrait aussi traduire si c'est le cas. For your privacy, please do not share personal health information. And if you have a question, please try not to be too specific. Do your best to generalize the question. The medical information shared in this webinar is an information resource only and is not to be used or relied upon for any diagnostic or treatment purposes. This information should not be used as a substitute for professional medical advice, diagnosis, or treatment. So let's get into the nut of this, or the meat of it, rather. Welcome to our third Brain Health Get-Together. This is where we talk about women's brain health. My name is Kate Holmes, and I'm the Director of Development and Education here at the Dementia Society of Ottawa and Renfrew County. I'm not sure, the slide seems to be advancing by itself, so hopefully we'll stay on this one. I have a few items to share with you before we get started. To talk about our brains, a little bit about us. We have to use this opportunity to tell you about who we are and what we do. The Dementia Society of Ottawa and Renfrew County is a standalone entity, meaning we're not a part of a provincial or a national organization. We were founded here in Ottawa some 40 years ago around a kitchen table, which I think is a wonderful visual to talk about people getting together and solving problems. And that was that get-together was as a response to the challenges of supporting people living with dementia. This, supporting people, is our mission and our vision, that no one should face dementia alone. But we want to get ahead of that, as it were. We now know, many years later, that we can prevent some forms of dementia. And so this too is a part of our mission. We want to make people aware to help them prevent dementia when we can. We're funded in part by Ontario Health. And through various initiatives, we raise funds to provide free programming and support for people living with dementia and for the people who care for them, to raise awareness for brain health and dementia. And some new information, since we've just had our annual general meeting last night, with donor support, we know that we achieved 175% of our ministry funded target for caregiver interactions. That is 75% of that work is not funded by the Ministry of Health. It is in fact funded by donors like many of you tonight. So we know that we're reaching more people with your help, and we know we can do more with your help. On our first webinar, I told you about Dr. Marguerite Ritchie, who is a woman who is a lawyer here in Ottawa, worked for the federal government, who made a significant gift in her will to the organization, which has helped us to kickstart this brain health initiative, specifically looking at risk factors and opportunities for better brain health for women. And tonight I want to tell you about another donor. Maybe some funny builds in here. This is a story of a person who did ask to remain anonymous, so we will continue to honor that. In life, she asked to remain anonymous. She lived in Ottawa for some 80 years. And then the reveal of all the other bullets. She was a teacher to special needs children. She was a special woman who sang in her church choir. She was never married. She enjoyed travel. And she was greatly affected by her mother's dementia. So far, with all due respect, it's not an extraordinary story. It's a very rich life, but it's not an extraordinary story. But what follows, I think, is really extraordinary, and this is why I want to share it with you. She started donating to our organization about 20 years before her death. with a simple $25 donation. I think when I look through the records, it was $25 here and there, maybe a couple of times a year. In 1997, she contacted our organization to inquire about planned giving, fancy terms for making a donation in your will, a bequest. There are lots of different words, but it's really an intentional gift left as a legacy. And what a legacy this was. I mean, this person lived a very humble life and wanted to do good anonymously. And at the end of the disbursements of all of these, of her estate, in the end, we received $1.7 million. And it's really hard to say that to a screen. I'm basically talking to myself right now. I sort of feel like I need a reveal, and that would have looked really tacky to put up a big slide with 1.7 million. But it is such an incredible number that helps us to do so much more good and to reach so many more people. And the reason I want to share this with you is not because clearly she wasn't looking for fame, but she wanted to do something significant. Not everybody has that kind of money to give as a bequest, but her story started simply, bit by bit she gave, and then she gave a lot, and that is a transformational gift, and it's helping us to move forward into our next chapter, which includes more news that we'll share later this year. But anyway, I won't get ahead of myself. I'm just really moved by this, and I wanted to share with you because it is such an extraordinary story with such a moving impact. On a more jolly note, perhaps, just want to tell you a little bit about what our current fundraising initiative is, because we always need to help more people, and so this is what we do. The Brainy Active Challenge. So we're in the third year of the Brainy Active Challenge, which is really our fundraising initiative to help promote awareness of the fact that you can prevent dementia while raising funds for our organization. So this year, in its third iteration, we have the Brainy Active Challenge, which is running from the 1st to the 21st of September, because it takes 21 days to build a habit. And so we have many ways for you to participate. We have different streams. If you sign up for Getting Mindful, which is all about mindfulness and meditation, or Get Nourished, which is about nutrition and what we consume and how that contributes to our health, or Get Moving, which is about integrating more movement into your daily routine. We have thought leaders, experts who will share tips with you, whether it's a podcast on mindfulness or exercises you can do to get moving a little bit more. That's one way to participate, and we would love to do that because it helps everybody to build their own brain resilience. Another way to help is just to donate to the campaign simply. And then we really want to celebrate. So we are planning a live event because we've all perhaps had enough of webinars, and we're hoping that conditions permit that on Sunday, September 25th, we can all get together and celebrate, and it will also be an information fair about brain health and dementia support. So where can you do that? You can go to brainyactivechallenge.com and help us so that no one has to face dementia alone in our region. Before we get to the Q&A, you probably want to hear from our guest speaker. So tonight we have invited one of our board members to talk to you, an expert in vascular health. So I will just read her bio, which is ever so impressive. Like many of us, Louise wears many hats. Dr. Louise Laramée defines herself as a wife, mother, daughter, cardiologist, teacher, mentor, and strong advocate for cardiovascular health. After receiving her MD degree from the University of Montréal, she specialized in internal medicine and cardiology here in Ottawa and completed her fellowship in interventional cardiology at the Mid-America Heart Institute in Kansas City, Missouri, with additional specialized training in Michigan and in Rouen, France. She then joined the Division of Cardiology at the Heart Institute, Ottawa Heart Institute, and over the last decade became involved in cardiac rehabilitation at Montfort Hospital. She's a medical educator, having been involved in the training of a few generations of medical students and residents, with a particular dedication to the volet francophone of the University of Ottawa MD program. Among other roles, she served as an examiner for the Royal College of National Certification in Cardiology, as Francophone co-director of the medical school's Clinical Skills program, and assistant dean of student affairs. Louise is a graduate of the Distinguished Teacher Program and has been the recipient of the Canadian Association for Medical Education Certificate of Merit Award and the Faculty of Medicine Educator Award twice. She's a certified health coach, trained in patient self-management and motivational interviewing. Her interests include cardiovascular health and disease prevention, women's heart health, and medical education. And she has served on numerous committees to advance these interests. In 2020, where she now serves as secretary, her goal at this stage of her career as a vascular specialist is to engage people and patients alike to educate themselves on how to stay healthy, risk factors, and get the support they need so they can live their best life. Louise, welcome, and thank you very much. And don't forget to take yourself off mute. There you go.
So there you go. Well, hello there. Hello, everyone. Understand that there's people from all over the place, not only Ottawa, Renfrew, but perhaps did I hear the UK, the US? So dementia unites us all. I'm so thrilled to be here with you tonight or this afternoon, whatever time zone you're in. Welcome. So I do have a personal connection with both dementia and the Dementia Society. My mother, Rita, who's passed away now several years ago, navigated with us through many stages of dementia. And, you know, as a cardiologist, I can tell you it's our secret that I don't know what I was thinking then, but I kind of thought that dementia just, I don't know, it hits you one day and kind of insidiously, something like lightning, but, you know, a bit slower, obviously. I don't know what I was thinking. Well, I was so wrong. I just did not know that actually my training and my knowledge in vascular health and disease was completely relevant. Honestly, I don't know where I would have been. I'm an only child. I'm not whining. It's too late for that. But I don't know what I would have done, me and my family, my husband, my kids, without the support of the Dementia Society. So way back when, Mom passed in 2005. And way back when, I attended all the educational sessions that were available, whether I whether I liked the topic or not, difficult behavior, like name it, I was there. The support groups were very good. And the dementia coach, in fact, Mom was bilingual from Montreal originally, and she was bilingual, but certainly preferred her native language as she got older. So as a francophone, and there was Monique, our dementia care coach, and Monique actually again was given an award yesterday at our AGM. Monique has remained a coach, so it was very valuable. So I'm very happy to share with you some information. I'll be sharing my slides soon, but I like to pretend that I can see you in the eyes, that I can see all of you, but certainly feel the love. I'm just excited to have hopefully a discussion with you at the end as well. I'll share with you some knowledge. If you know something about vascular health and disease, I'm hoping that you'll learn a few tips. I'm pretty sure that you'll learn a few things. And if you don't know anything about vascular health and disease, well, all I can say is fasten your seatbelt. We're going. So I want to prove to you that dementia is not inevitable. Au contraire. So let's get started. So I'm going to share my screen. Hopefully, I'm not going to be sharing my emails. So can you see my screen? It should have a little bit, hold on, I'm kind of, it should have so Kate, can you help me?
Yeah,
it's perfect, great. Louise.
It looks great.
Perfect. Okay, excellent.
Thanks.
It should have two little cute little bonhommes. I call them bonhommes. There's a little brain bonhomme and a little heart bonhomme, and they are hand in hand and taking a selfie. So women's vascular health and risk factor for dementia. So let's just move to my next slide. Hold on a second here. So we'll talk about the heart and the brain. So what do they do? How are they different and how do they connect? We'll talk about the atherosclerosis, which is vascular disease, which is basically what's the cardiovascular connection. That's what we'll talk about. Who is at risk for dementia? why dementia is not inevitable, and what you can do to prevent dementia. So, cardiovascular disease, who knows that it's not cancer that's the #1 killer? Turns out to be cardiovascular disease. So what is that? So it's heart disease and stroke, but also, and we'll talk about the difference, but it's also all the diseases of the vascular system. So we'll spend a little bit of time learning about the vascular system. It includes disease of the aorta, the large vessel that comes out of the heart, and basically feeds all the other arteries of the blood. So it's a significant problem. So the heart versus the brain. So let's get clear on the lingo. So the heart. So what is the heart? Well, it's dear to me, of course, as a cardiologist. Most people have one. So it's the engine, right? It's the engine of the body. Its job is to pump the blood with oxygen through a set of tubes that are arteries, and to bring the blood flow with the oxygen to all the body. It needs its own oxygen. It needs to be fed by blood flow as well. And what you see on the slide in red are, you see bits and pieces of the 3 main coronary arteries. So the arteries that feed the blood to the heart are called coronary arteries. And if you're old enough, or you heard your parents or grandparents called about what a heart attack used to be called before, people didn't have a heart attack, they had a coronary. So that's where it's from. So now the vascular system. So every organ of your body, every body part, every cell needs blood flow, needs oxygen. So this is what the cardiovascular system does. The arteries carry the oxygenated blood. So that's why when we're in, I don't know, grade 6 or something, we draw them in red, and that's why they're on this diagram is in red as well. Generally, the arteries are called by the name of the organ that they perfuse. So, for example, the renal artery, well, it perfuses the kidneys. The pedal artery feeds the feet. Anyways, you know where I'm going with this. One of the big issues with vascular disease, of course, is that you don't know until it's quite late. So we have the aorta is the large vessel, as I said, that where the blood comes out of the heart, and it feeds the arteries to the arms, the arteries to the legs, and also, of course, the arteries to the brain. So on both sides of the neck, we have arteries that are called carotid arteries. And of course, they feed slightly smaller arteries that are in the brain, and we call them cerebral arteries because it's cerebral, it's in the brain. And from there, it feeds a network of very small arteries that feed all the parts of the brain that, if you could actually read the slide, what you would see is every part of the brain has a different function, is responsible for a different, either a cognitive function or a higher level function, whether it's movement, sensation, language, vision, and all that. So that's our cardiovascular system in a nutshell. So what's atherosclerosis? Well, you certainly don't need to remember the name, but I would like to be clear enough so that you understand the concept. So atherosclerosis, what that is, vascular disease. So on the top frame, you see an artery that's a representation of an artery that is meant to look normal. You see that it's smooth inside, you see only half of it, of course, and the arrow is meant to represent the blood flow that goes through unimpeded. So that's normal. Over time, and we'll talk about how it develops, but there's what we call plaque buildup. So there can be, and we'll find in most of us, there is accumulation of lipid deposits, cholesterol. So if you've ever had a discussion about cholesterol with your doctor, or nurse practitioner or nurse, the reason why we freak out about the cholesterol is that it's the beginning of the plaque. So there's it's a lipid core. So here it's represented in yellow. And this buildup is called either a plaque, sometimes we call it blockage. And when we do coronary angiograms, when we have a look with dye at the arteries of the heart, we describe it as stenosis. It's all the same thing. Don't remember the words, but it means that you see accumulation of plaque buildup inside the wall of the artery. And as you can see, there's less room for the blood to go through. So it's a narrowing. So we also call it a narrowing. Anyways, it's so it impedes the blood flow. So, and you remember that, of course, it carries the blood, but it carries the oxygen so that the parts distal to it downstream can receive the oxygen. So that's plaque buildup in yellow. And what you see in the bottom frame is that sometimes the plaque bursts. We call it plaque rupture. And what does the body do? You know, you cut yourself, what happens? So very quickly it'll stop bleeding because your body will say, I need to patch this up with a clot. So with a clot that is just sufficient to stop the bleeding. So I'm kind of, I don't know if you can see, but I'm kind of showing if I did hit my hand, it would bleed for a bit and then my body would take care of it. Well, the body doesn't know the difference between my hand and this artery. So if there's an open wound, which is how the body sees it, with this plaque rupture, what it tries to do is to patch it up, but it'll patch it up with a little blood clot that can be in a small artery that can be the size of the lumen of the inside of the artery. And there you have it. You have a blood clot that blocks the entire artery. So what do we know about what happens when an artery is blocked? Again, there's no blood flow downstream, no blood flow, no oxygen. So the tissue starts dying. So that's why when we talk about the importance of calling 911 when somebody has symptoms of, in my work, of course, it's heart, so chest pains, to call 911 is that time is muscle. So the time that the artery is blocked and there's no blood flow, if it's not restored, that part of the heart will die. So let's talk about let's go back to atherosclerosis, and then we'll talk about heart attacks. So atherosclerosis builds over time. That also doesn't come like lightning one day. It builds over years, decades. So you see on this picture, so at birth, our arteries look beautiful. They're nice and smooth. So that's kind of on the left hand side of this representation. And with time, and you may be surprised to see, if you look at the bottom, you see at 10 years of age, at 20 years of age, at 30 years of age, and so on, there can be and often is the beginning of atherosclerosis. So the first thing is fatty streaks. Again, you don't have to remember what they're called, but how do we know that atherosclerosis starts in the teen years and early adulthood? Well, the best evidence we have is sadly with autopsies. And I think the first reports were from soldiers in the Korean War, and of a number, I think it was 107 autopsies that were initially done. And these in those years were young men, on average 22 years of age. And a number of them had fatty streaks and intermediate lesions. So we know it starts early. But, you know, you say, well, it's autopsies, it was then. It's been repeated many times in the Vietnam War, in people that die from traumatic causes quite early. But we can also see it in the living. So the top frame, now you see what an ultrasound picture, so that looks like, if you've ever seen ultrasound pictures of same technology as for pregnancy. So the left-hand frame, so this is a carotid artery, so one of the artery of the neck. So we can see it live. So obviously this is in the living. So we take pictures and you see in the frame A, an artery that looks pretty smooth, pretty normal. You see the black is the inside of the artery where the blood can flow. Nice, wide, unimpeded flow. You see on the B and then the other frames, you see a thicker, so the small on the B frame, you can see that small arrow that shows maybe like a 1 millimeter thickness of the plaque. And so we call it CIMT because it's carotid. It's the distance between two layers of the wall of the artery, the intima and the media. So it's called carotid intimal medial thickness. So you can measure that and you can see the plaque. So you can see that the person who owns the carotid in frame C has more buildup of plaque, and you see D is even worse, and E is a complex plaque that probably has, I think we see some thrombus, some blood clot with that. So atherosclerosis starts early, so we better find out what causes it, and we'll talk about this. So back to the cardiovascular connection. So stroke or heart attack. So we talked about how an artery can block, plaque rupture, superimposed little blood clot, blocks the artery completely. So on the right side, if you talk about the heart, it's the heart that lacks blood flow. It's a coronary artery that is blocked. There's no blood flow beyond. If the flow is not restored, if that part of the heart doesn't get oxygen within a fairly short period of time, like we're talking an hour or less, then there's damage. So for the heart, we call it an infarct or infarction, myocardial infarction. Interestingly, in France, they don't tell people you've had a heart attack, une attaque de cœur. They say, vous avez eu un infarctus du myocarde. They really call things by their, by their medical name. It's really quite remarkable. Anyways, I digress. So let's go back to the left side with the brain. So if an artery, whether the carotid or one of the arteries in the brain, cerebral arteries or smaller, blocks, what happens? No blood flow beyond. That's an infarct because it's in the brain. It's a cerebral infarct. So that's the difference. So sometimes, when we take medical history and we'll ask a person, so, is there a history of heart disease in your family? And many times they'll say, oh, I think my father had a stroke. So it's often very confused, and it isn't confusing, but basically a stroke is from the brain, causes paralysis or other defects or other problems that are related to the brain function, versus the heart, of course, which causes a heart attack that most people know. So dementia, what is dementia? Well, of course, or you wouldn't be here today. But it's important to know that it's not a specific disease. Rather, it's a general term that is used to talk about the impaired. So that's a definition of CDC. A general term for the impaired ability to remember, think, or make decisions that interfere with doing everyday activities. So it's not a specific disease. Dementia is an umbrella term. It's an overall set of symptoms that are caused by disorders that are affecting the brain. So it's not a normal part of aging at all. It's caused by damage to the brain cells. And you may know many of the symptoms that someone with dementia may have: memory loss. Not always. For example, my mother, her memory was really quite good. What went first was the thinking, the higher level thinking, processing, the judgment, problem solving. She had difficulty following, what the scenario was, what was going on in a movie, for example. Language can be affected, and that certainly was her case. Her English was affected more than her French. So severe enough to affect their ability to perform everyday activities, like we say. And what causes significant concern for caregivers is managing difficulties with emotional control that the person with dementia may show, and changes in their social behavior. So you'll say, so dementia. So now you're talking about dementia. So Alzheimer's, dementia, is that all the same thing? They seem to be used interchangeably. Well, they're not. Actually, Alzheimer's is a disease. So it's easier if we call it Alzheimer's disease. So it's specific. It's a specific cause. It's one of the specific causes of dementia, and we'll talk about it in a moment. Here, do not worry, I don't want to make you a pathologist, me neither for that matter, but just to see what is specific about Alzheimer's, and it'll be relevant to the rest of our chat. So on the left side, you see what a health representation of what a healthy brain should look like. And at the bottom, you see what healthy brain cells should look like. Kind of, it's a drawing, but so these brain nerve cells, they're called neurocytes, or neurons, interesting how we translate in our brain. So these neurons normally have that look. So look on the right side. So you can see that in severe Alzheimer's, of course, the brain has shrunk. So that's one of the consequences that most people get with dementia. And there's other changes, but what's specific with Alzheimer's is two things. And this time I will ask you to, at least for 10 minutes, to kind of remember those two words. So there's two things that happen that make among other things, but that make a diagnosis of Alzheimer's disease specifically. So one is deposits in the brain. So it's called beta amyloid. So amyloid deposits, basically, so because these clumps occur, I'm going to say grow here and there in the brain, it prevents the interactions between the cells. And there's another process that happens is we have tau proteins in those brain cells, and it doesn't really matter what they're called, but they become abnormal and they form tangles. So they call them tau tangles. So when you think of Alzheimer's disease, that means that there's been some evidence of tau tangles and amyloid deposits. So back to the different types of dementia. So Alzheimer's is the #1 cause. 60 to 80%, well, certainly more than 60%. So that's very predominant. But vascular dementia is the second most likely, almost 1 in 5. So we'll spend a little time talking about vascular dementia. And of course, mixed dementia, the name says it, that it's generally a combination of 2 or more types. And it can be vascular dementia with some components of Alzheimer's. So it can be a mixture. So when you add them all, actually, you're at almost 90% of causes of dementia that have some link with vascular disease or Alzheimer's. And we'll talk more about the relationship. So this is from Alzheimer's.org, Alzheimer's International, the UK branch. So, so hi to you in the UK. So what causes vascular dementia? Well, here, the slide's a little busy, but there's basically 2 things that the arteries, that the blood vessels can do. They can block. So we've talked about this at length. So what happens beyond death of that tissue? If an artery blocks, no oxygen, death of the tissue, there's damage, and we call it an infarct. So it can be a bigger infarct, like the blockage of one of the common artery that causes paralysis, that causes being unable to move one side of the body, for example. It's the MCA, the middle cerebral artery. So depending on what part of the brain, what side of the brain this occlusion occurs, the symptoms will be different. So, but that's an infarct that is big enough to be clinical. So it's a clinical stroke. But it can be smaller as well. And that's what we find, those lacunar or micro always means small. So those small infarcts, they can be subtle, they happen progressively, and people may not have symptoms. So it's a kind of a Swiss cheese kind of story that when there's enough holes, then you start seeing symptoms of dementia. So that's when the arteries block, infarct, always. But the other things that arteries can do is they can leak. So when they leak, it leads to bleeding in the brain. So you can see that's not a good situation either. And if it's a small bleed, of course, it's in a specific area of the brain, well, it's smaller damage. And if it's a large bleed, of course, it can be life-threatening. So vascular dementia is a mixed bag of some lacunar infarcts that we see many times. You just do a CT scan for, I don't know, somebody comes in with a headache, and they may or may not have hit their head, but and you'll go, have you had high blood pressure? Oh yes, for years. It's been borderline, or it's been difficult to treat, whatever. And sure enough, you see a lot of lacunar infarcts, and the people did not know. They don't necessarily have symptoms of dementia, but they did not even know that there was anything wrong in their brain. So vascular disease of the brain is significant. So now the risk factors, who's most at risk? So of course, what we consider a risk is, let's do an analogy of, driving on the road. So, if you drive at 180K on the highway when the K per hour, when the speed limit is 100, well, that increases the risk, both the risk of an accident and the risk of dying of an accident. So it's an increased risk. Driving impaired increases the risk. So some of the risk, in some, getting away from the car analogy, but some risk is modifiable and some is not. So the cardiovascular risk factors, so that affect the heart and all the blood vessels. So the non-modifiable, of course, we'll get them out of the way, but there's nothing we can do about this age. So as we get older, there's more chance of getting sick. There's more chance of having heart disease. It kind of goes hand in hand. And it's the case also for dementia. Family history as well. We don't choose our parents, apparently, and ethnicity. There are some ethnic groups that have a higher risk of cardiovascular disease. But the modifiable risk factors is what I want to focus on. So just to backtrack, so these are factors that these are situations or diseases that puts the patient at higher risk of a cardiovascular event that we talked about, the #1 killer. So we're talking about smoking, diabetes, cholesterol problems, so hypercholesterolemia or hyperlipidemia. Lipids are all the cholesterol subfractions together. Hypertension, high blood pressure, obesity, and lack of exercise. So what causes vascular dementia in the end? Well, at the top, you see that's the collection and concoction of the modifiable and non-modifiable risk factors. Like we saw, they affect the blood vessels in the brain, large and small, and either cause large or small infarcts in the brain. There's also white matter change. We won't go into those into this today, but leading to vascular cognitive impairment, called VCI oftentimes, or mild cognitive impairment. Cognition is basically the upper level executive functions of the brain, like the acquisition of information, storage of information in the brain, retrieval of information, so remember, memory, navigation, planning, all these kinds of functions. So, but you don't have to take my word for it. How do we know? What's the evidence? Where's the science? So there's multiple studies, and I just want to cue you in towards one that's called, that's one of the landmark studies, that's called ERIC. So the atherosclerosis risk in communities. So what they did was, again, if you could read, what you would see is that, not that you can't read, but it's pretty small. It just to remind me. So they looked at about 16,000 participants, and who were at the beginning of the study between ages 44 and 66. And what they did is they followed them for 25 years to see who developed dementia. And what they did is they also acquired in all these people what were their risk factors, just like we talked about. So just to share some results here, So first we'll talk about so how do we assess risk? How does, in this study, they reported increased risk. It's with something called, it's quite simple actually, the hazard ratio. So if your risk and my risk is the same, hazard ratio is 1.0. Here you can see in this study that the smokers, so smoking was associated with a hazard ratio of 1.41. That means the smokers had 41% greater chance of developing dementia in those 25 years. For hypertension was 39% more, hazard ratio of 1.39. And for diabetes was 77% higher chance of developing dementia. And in fact, what they found is that for diabetes, the risk was just about equal to the genetic susceptibility. We won't talk about the ApoE, the apoprotein E4 allele. We won't talk about that today, but diabetes is as important as the genetic susceptibility. So what does diabetes do? Well, it does a lot of bad things. We're talking about a diagnosis of diabetes, but we're talking about uncontrolled blood sugar in diabetes. So diabetes that's controlled, that's certainly the best that can be done and should be done. So diabetes, so just think of a higher blood sugar in liquid. So let's take maple syrup. So maple syrup, and you can imagine, you can visualize how it flows and how it would flow in a little tube. Not so fast. And of course, the blood sugar kind of stays there and is ready, along with the other components in the blood, the lipid, the cholesterol, is ready to be absorbed by the wall of the arteries and create plaque. The blood flow is also not very good. So of course, the delivery of oxygen downstream is not very good. So you see there are so small vessel disease, development of atherosclerosis, those infarctions that we talked about, the local toxicity of the glucose. And here are, well, not our friends, actually our foes, the accumulation of two things, amyloid, and then the tau tangles. So again, link with Alzheimer's. So it's not all genetic. And worse, the diabetes is a greater risk factor both for cardiovascular disease and for dementia in women. So a woman with diabetes fares worse than a man with diabetes. So what about hypertension? Well, hypertension causes all those things we talked about. Of course, it's a big stress test for the arteries. They become stiff, small vessel disease, large vessels, stroke, brain atrophy, shrinkage. And here's our foe again, accumulation of amyloid causing cognitive impairment. And women with high blood pressure, hypertension, are more at risk of stroke than men. And it's remarkable, and it's been well known for decades. So in Canada, we have the great fortune of having the Canadian Women's Heart Health Alliance that was created a few years ago. But if you can, I don't know if you can read at the bottom of the slide, the website. I strongly encourage you to go and check it out if you're interested in women's health altogether. It's CWHHA for Canadian Women's Heart Health Alliance.ca. And so this slide, this chapter talks about the sex and gender unique manifestations in women of cardiovascular disease. And of course, we won't go through it all, but you see at the bottom right, stroke and vascular cognitive impairment. Women have unique risk factors that make them vulnerable to stroke across the lifespan, particularly during pregnancy and postmenopausal aging. What? Did I say pregnancy? Yes, I did. So it hasn't been known for that long. I mean, not decades, but certainly the last 5 to 10 years, it became clear that adverse pregnancy outcomes are a risk factor for future cardiovascular disease in mom. So what does that mean, adverse pregnancy outcome? Well, it used to be that if a woman during pregnancy developed high blood pressure or prediabetes or even just glucose intolerance or diabetes, then once they delivered the baby, blood pressure went back to normal or blood sugar went back to normal. Not to worry, dear. You're fine. It's all gone. No worries. Maybe be careful next pregnancy, but that was the end of it. Now we know that that's not true. Pregnancy is a major stress test for the cardiovascular system. And if there are kind of pre-existing conditions, they will be uncovered during pregnancy, and they may get some relief once the baby is born, but the development of further hypertension, diabetes, metabolic syndrome really has to be considered, and it's really quite frequent. But overall, we know that it's a cardiovascular risk factor. Also, having a baby that's small for gestational age and preterm delivery, that's also a risk factor. So throughout Canada now, there's a few, not enough, but there's a few cardio obstetrics clinics where these moms are followed long-term for their cardiovascular health because they are at risk. So what about children? Well, childhood obesity is also a risk factor for cardiovascular disease. We know that since compared to before COVID, now the rate of increase of obesity in children, so the rate, I'm talking about the rate of increase has doubled. So it's really quite worrisome. Childhood obesity, of course, brings all these risk factors that we talked about, the hypertension, the cholesterol, the dyslipidemia, the dysregulation of glucose or prediabetes or diabetes, and development of atherosclerosis. And they have decades in front of them for all these risk factors to continue to affect their blood vessels. And we can see that by looking at the ultrasound of the carotids, by the CIMT. So we really think that, you know, if nothing is done to control these risk factors and obesity, that there's a tsunami coming for both dementia and cardiovascular diseases. So we've looked at this whole continuum, this lifelong sequence of vascular risk factors leading to subclinical atherosclerosis, leading to some issues with atherosclerosis in the heart, in the brain, and cognitive decline. So that's kind of a summary. So now for the good news. So this is from Nature 2014, but these are current recommendations. Current strategies to promote cardiovascular health might be the most promising approach to protect the brain and maintain intact cognitive function as we age. So we'll go back to dementia particularly, and there used to be 9 risk factors identified for dementia, and they added 3 more. So this is a slide from Alzheimer's International, pardon me, but these are the common, the well identified 12 dementia risk factors. You'll see highlighted in red are, of course, the vascular risk factors that we just talked about. But in addition to that, depression, infrequent social contact, that's huge. Hearing impairment, that's also a way to be isolated from other people. Other than that, repeated head injury, less education, and excessive alcohol consumption, as well as air pollution, which was one of the few added more recently. And what's worse is the awareness of risk factor for the risk of dementia remains low. When people were asked to consider what do they think would increase a person's risk, the most common response included being less mentally active and genetic factors. But very few people named the physical risks of hypertension and diabetes and everything we talked about that are the major risk factors. So prevention is hard work, but it works. And it's estimated that 80% of cardiovascular diseases, including heart disease, stroke, peripheral vascular disease, can be prevented or preventable. And what's great in a way is that the same strategies also can prevent cancer. So 30 to 50% of all cancers are preventable. There's some cancers that we don't have a clue how they occur, but some are largely preventable, bowel cancers being an example. So 9 ways to reduce your risk. If I got you thinking about what you can do, again, knowledge is great, but taking action. So I would ask you to kind of look at this and think about your environment. The women are often, I see on our webinar, there's probably the majority of women interested in women's health as well. But women were often the CEO of our family in a way, like unofficial, but without a salary, but with so much reward. But looking after everybody's health. So whether it's our parents or our children, so that's important. So improving, so in 1 in 3 cases of dementia could be prevented by addressing these. So I talked so much that by now you've read the slide, but addressing a decrease in hearing loss, addressing hypertension, obesity, smoking, diabetes, depression, and the education is so important, and we're talking like formal education and continuing education, physical activity and social contact. And the good news is it's never too late. There's different levels of prevention, but it's all prevention. So primary prevention on your bottom left, you try to avoid the development of the disease altogether by removing the risk factors. But once the disease is there, it's a matter of secondary prevention to detect it early and to prevent the progression of it. And finally, tertiary prevention is about reducing the complications and preventing further complications. So the AHA, the American Heart Association, came up on their agenda for brain health with this very simple approach, Life Simple 7, modifiable risk factors across the life course. And again, it's for brain health, it's everything we talked about: lipid control, blood pressure control, no smoking, regular physical activity, reducing diabetes risk or managing it, healthy diet and weight control. And basically, if you were to look on the AHA website, you would find Life Simple 7, the same for cardiovascular diseases. And if you look on a lot of cancer organizations, you find the same thing as well. So it's one-stop shop. And I just wanted to show you this because it's quite remarkable. So it was called the FINGER trial. It's the Finnish Geriatric Intervention Study. So it's really quite cute. So what they did is they enrolled about 1,200 people, and at enrollment they were between 60 and 77 years of age, and they all had to have modifiable risk factors, and they all had to have cognitive testing, and to be at average or slightly below average for their cognitive testing results. And they randomized them to either so randomized means they made 2 groups, and at random they assigned them to either just regular health advice, regular care, or what they called multi-domain intervention. And this intervention, so these people were given both education and coaching, nutritional guidance, physical exercise, they had cognitive training, social activities, and of course they had all their risk factors, the vascular risk factors, well managed. And after 2 years, not 20, after 2 years, the cognition based on neuropsychological testing improved by at least 20%, by approximately 25% in the intervention group. And even people with a genetic susceptibility had clear cognitive benefit. So this is really quite powerful. And of course, their risk factors were better controlled. So this is ongoing now. So they formed, it was so impressive that they formed a international collaboration. And it's called now the, I guess it's a WWF, I'm just realizing now, but anyways, the Worldwide Fingers. It's harder to tell, but not quite the same. So what can you do? And I'm going to conclude very shortly. So know your numbers, know what your blood pressure is, where it should be, and how to get there, get the support. The same, know your BMI, your body mass index. Just Google your BMI, you'll find scales for, not scales, but you'll find calculations for you put in your height and weight, and it gives you your BMI, and it tells you whether you're average, below average, whether you're overweight or obese. And, you know, the first thing is to realize where we are and where we want to be. Waist circumference, the different cholesterols, the bad cholesterol, the low density lipoprotein, the LDL, and the triglyceride, and know your fasting glucose. So, you know, all of these measures, they have numbers, and you can follow them, and you can track how far you are, if at all, from the target. So bottom line on vascular dementia. Well, I hope I was able to show you that dementia is not inevitable. Vascular diseases and even Alzheimer's disease can be mitigated by the knowledge, the management, and the control of risk factors. Vascular disease is no accident. It's progressive. It starts in childhood and teenage years, and it's accelerated greatly by the presence of obesity, hypertension, diabetes, smoking, sedentarity, not moving enough. It's never too late for prevention. Know your body, know your numbers, decide to do something good for your heart every day, because what's good for the heart is good for the brain. Get educated on what you can do, get the support you need to get it done. Finally, I will leave you with healthy lifestyle is a one-stop shop. The same vascular disease prevention strategies will reduce the risk of most of the diseases that we fear, the heart disease, stroke, cancer, and dementia. So I'll stop with the first question, but that you don't have to put your answer in the chat. But what will you do to prevent dementia? What do you want your life to look like down the road? So 3 small changes you're prepared to do for yourself. And again, I encourage you to educate yourself, to start conversations. If this was all new to you, it may be overwhelming. Well, at least you know. If you remember 20% of that, at least you know dementia is not inevitable. So I'll be happy to answer questions. I'll stop sharing my slide and hopefully see people instead of my slides. So let me stop. Stop share. There we go.
You at least get to see me, Louise.
Yes. Oh, yes, I don't get to see everybody. Well, hello, everybody, anyways.
And hello again. Yeah, so we have a few minutes for Q&A, and I've been following what's being said here, and there's a bit of a trend, but just if we back up the bus a little bit, not to, you know, at the risk of sounding incredibly simplistic, I think ultimately what we want for good brains and good hearts is blood unimpeded coursing through our body to get that oxygen to our brain. And there are lots of things that we like to do, eat, sit, there's a genetic component, but that don't contribute to that. So what we want to do is get people moving, get people connected to people. That sounds very easy, but I'm not sure it is all the time. And I think you've given us, you know, it's hard work, but it's worth it. The comments that I'm seeing are there are a few things I'll just pose, but I'm just from a trend perspective, there are some questions around what can be reversed. So we'll go to that in a minute, but there's one just sort of a level setting question. But before we go to that, I just want to repeat that we will be sharing this as a recording on our YouTube channel afterwards. So people can expect to receive the link to the presentation that way. A level setter, which was, could you please explain the word cognition? We
Yes.
use it a lot in our little world here, but it's maybe not everyday language.
No, exactly. And I kind of brushed quickly on that, and I realized, but I thought, you got to get going, girl. You have other things to, but that's key. So thank you, whoever asked, or whoever, however many people asked. So cognition is all the higher level thinking. So you need, the cognition does not involve like I'm raising my arm or I'm breathing, like that's reflex. Cognition is the higher level thinking, and that's what goes in dementia, of course. So acquiring information. So you told me something 5 minutes ago, and I don't remember it. I had either difficulty hearing, could be that's not cognition, or I could not store it in my brain because they were either these tangles or these deposits, or I've got this Swiss cheese in my brain. So acquiring the information, storing the information, being able to retrieve it. I know this guy, what's his name again? Like, we all do this. It's our cognition that allows us to do this, but it also involves like planning, like navigating. So it's I hope I answer. It's all those complex. It's not just repeat after me. That's pretty simple. But how am I going to get to the grocery store because the road I always take is blocked? Okay, so I need to backtrack to this, and maybe I can take that street, and there's a one way I can't do, so it's complex. So you need to be able to troubleshoot. So I see some chats happening, but that's not. I want to answer, but you're the boss, Kate. You're the boss.
There are lots of questions. I'm just trying to summarize. And we can ask specific ones, but people have asked about whether, if one can clear the presence of tau from the brain, can you recover? I think it's not as easy as that.
So that's, all questions are good. And that's a good question. We do this in medicine a lot. We describe what is there physically or what's missing physically, but in our everyday life, like, that really doesn't matter. It's how it functions. So even if we have, so I might have, deposits and tau tangles already, who knows, I might have some vascular issues already, but I'm able to put things together. I keep myself, I'm comfortable in putting myself in situations where I'm uncomfortable, learning things. So we know that the brain, there's something called neuroplasticity. The brain is very, it can teach itself things. So, if there's obstacles here and there, it can find new paths. So I think the best we can do is to work with what we have, and to maintain what we have. And so it's very interesting, going back to the Dementia Society, but back then there was the only program that didn't exist were the social programs, and now you find that there's a lot of social programs. And it's not just to keep mom and dad busy and to do something and get them out of the house. It's really important, these interactions. And as caregivers, it's really important for us as well. So again, I digress a little bit, but we shouldn't worry so much about whether we do have these amyloid plaques or something. We have to work with what we know. And of course, like, again, the seven, the simple seven, nobody learned that today, like we all know, but how do you do it? So, and my husband and I work in cardiac rehab now, and he's also a cardiologist. He's not there because he's my husband, by the way, but in any case, again, I digress. But we, it's to put yourself in situations where you try to make better choices about lifestyle. you realize, you know, for 2 years I've been sitting on Zoom in my office at home. And, you know, I used to go with Joe for a walk, and I used to go play tennis, but I'm still leery of COVID. Well, what am I going to do? So, you know, just having these reflections, and I think the discussions are important as well. You know, like to keep engaged, to learn new things, to do puzzles. For Brainy Active last year, 2 years ago, I started doing puzzles. I still do, you know, 30 minutes of, like, I have my 3 free apps. I'm a freeloader. You know, where I do it every day.
Louise, I just want to circle back to one thing, the question of if one can clear these proteins and tangles, but we can't, we don't know how. That's the problem. Again, right? So that's why Louise is stressing prevention. Deal with what you can do, because we can't reverse certain things.
No, exactly. So, and again, you know, there's many times we don't know until autopsy. So, you know, I mean, in the times of my mother, again, like there was no PET scan to diagnose those amyloid plaques. We didn't have the tools we have today. But it's not so much just what you have, is to continue with the function. The body has an incredible ability. So no, we can't remove them. Most of the diseases now, the chronic disease, in fact, all these risk factors we talked about, the World Health Organization calls them lifestyle diseases. What does that tell us? You know, so
get up out of our chairs.
Yeah, exactly. So it's not in a pill, but it's a lot more fun. So sometimes I'm hoping that this chat and our discussion stimulates more discussions about what more can I do for my heart. Do I know what my blood pressure is?
So on that note, Louise, people are asking if do they need to visit their physician to know what their numbers are? Are there other ways they can gather that information?
Well, there's a couple of ways, but engaging with your healthcare practitioner, I think that's very important. I was chatting with today's my clinic day. I was chatting with a patient today, and it was had a heart attack, and said, you know, do you know what your blood pressure is? I don't have a clue. Okay, that's good. So what's your blood sugar? I don't have a clue. But I think I was told that they're both like just a bit high. I said, you know, if it was tax time here, you know, recently, the CRA doesn't send you a letter and say you owe us a little bit of money. You know, the CRA tells you, you know, you owe us $112.48, right? So it's very important to know your number. So have this conversation. So what's my blood pressure? It's good. Well, good's not a number. CRA doesn't say send me a good amount of money. So what's my blood pressure? Where should it be? And how are we going to get there? So that's what you do with the know your numbers. Like anything else, right? Like, you know, you have to know where you start.
And it's not one and done. This is the conversation that you want to have every time you see your doctor.
Yeah, absolutely. That's very powerful.
Sorry, here's an interesting question that came from a gentleman who joined us this evening, who says, other than pregnancy, does everything that you've talked about this evening apply to males? Yes,
absolutely. Absolutely.
Yeah.
Yes. But that's good. No, thank you for mentioning. Again, you know, many of the cardiovascular risks affect women worse than men. And it's now common. Women's health, it took a long time to take off. But men feel, we do hear that, men feel left out. What applies to me? And in fact, there's kind of a new area in science that's men's cardiovascular health, which is most of the evidence that we have so far, actually. Right. But thank you for asking this, and thank you for being there.
Question referred when you were showing us a slide about the blood vessels, and we started early in life and pregnancy. If a child is born prematurely, do they have a predisposition to vascular disease?
So that's a good question. The child, I don't know. I want to answer, but it's totally out of my area of expertise. As a cardiovascular specialist, no, we do not we do not, we haven't identified that I know of a risk for the child, but it's certainly a risk for mom.
Okay. This is a popular one. Any supplements? I think it was vitamin D. Are there supplements that you would recommend for vascular health?
So
Omega-3, vitamin D.
good question, and you're not gonna like the answer. No, no. Food. All the food groups. So I shouldn't say that. Not for everybody. So when there's nutritional deficiency, of course, iron and folate are different. Obviously, folate for for women of that may become pregnant. That's important for the baby. But other than that, no. So that's kind of the medical response. That's kind of what I'm trained to say. So vitamin D and the heart, we don't have good evidence. Actually on that, I want to talk a little bit about the risks. We had so supplements, they are not harmless. So some of them are called natural. So the vitamins perhaps are different, but actually, no, I take that back. So, vitamin A, you can develop toxicity. Some vitamin E, with some of our cardiac medications don't mix well. And some supplements can either interact with medication that are, for someone who has a heart condition, for example. So can either interact, prevent it from working properly, or cause problems. So we've had, not just we, like all over the world, ginkgo is one that is common, and people either just, they develop a bleed. Not oftentimes, but in our world, it's when they're also put on medications for the heart. People that have atrial fibrillation, for example, that end up staying on their ginkgo and being on anticoagulants. We've had patients nearly bleed to death. So it's not, so the solution is not in a pill, is what I'm trying to say. Better choice with food, and again, women as and sorry sir, or how many others, but certainly the parents, we're kind of modeling the lifestyle of health to our children. So it's worthwhile to to make the attempt anyways. Sometimes to at least reflect. Sometimes we kind of eat what what we were raised to eat, how we were brought up. My father was a meat and potato man, and that's all he ate. And he died a lot younger than my mother, who was really interested in nutrition, and with her help, she had no business living to the age that she did. But nutrition was very important to her, and what's the link? Hard to tell, but so it's not in a pill. So to go back to the original question, any supplement we recommend? No. There's some supplements that we say it may not harm you, especially when I'm talking about people that are on medication already. But be very, very, very careful and have conversations with your physicians. Be open, and I'd say that too. Be open to the medication that is prescribed that you don't take because of cause ABC, because they're all good causes, all reasons, because they're your reasons. So mention that you don't, if you take it or you don't take it, or if you will or won't take it, and all the supplements that you take. And Google it if you must. Google the interactions. Teach your physician sometimes that just don't know. We're not trained much in that in medical school. I think conversations are key, asking questions, be curious. That's all if you're curious, if you continue to be curious, that's all I want today.
I think that's a perfect place to end our Q&A session. Thank you, Louise, and thank you for everyone who stayed on for the extra time. We're a little over our 1 hour, but I think it's great that people are this interested, so thank you. We do have one quick survey because you help us to shape future events, and so we have a quick survey. If we can pop that up on the screen, or I'm not sure where it appears in the chat. 3 questions about, did you learn something practical today that you can implement? And then topics that you'd like to see coming up next. So if you can just take a minute here on the end of this webinar to answer this. We will also be sending out a survey tomorrow, ideally tomorrow, with some more questions about where you'd like to see us going with this initiative, Women's Brain Health, in terms of topics and format. And we appreciate you answering that. We're giving you a couple of days to do that over the long weekend. And we will choose, or rather randomly select, 3 names from the people who complete the survey to win a nifty Dementia Society branded notebook. So you can write your numbers in them and take that to all of your doctor's appointments. I was looking for one. I didn't have it handy, but it's a nice little notebook that fits into a bag or you can easily carry. So with that, I think the poll is still running. Half of you have completed. In any case, I want to thank Dr. Louise Laramée for joining us this evening, all of the work that she's put into this and all of the years of experience and wisdom that she brings to the presentation today and to our board, our wonderful volunteer board. Merci beaucoup, Louise, et merci de vous joindre à nous ce soir. We're very happy that this is of interest to you, and we hope to see you again soon. We'll probably be back in the fall with another activity based on your feedback, and we hope that you'll join us for our Brainy Active Challenge. It's one way to get active in terms of doing good things for your brain and for your heart health. So thank you very much. Have a wonderful evening and a wonderful summer.
Merci à tout le monde. Au revoir.
Bonne soirée.